Hello everyone, my name is Natalia Padilla. I just graduated from Sunnyside High School and I will be attending the University of California, Berkeley to study public health. Like everyone, I was devastated with how much COVID-19 impacted the world, but I was more so left with questions, or rather ignorance, such as what actually is COVID-19? Is there a cure or vaccine for it? And what do we actually know about it already? Summer, I researched what looking for a vaccine looks like, and if there were any for COVID-19. Finding a vaccine for COVID-19 will affect the world globally since it is a pandemic and is continuing to spread every day. It is possible to slow the spread of COVID-19 through social distancing and wearing a mask. The only firm solution is to find a vaccine or cure. There are currently 3 possible treatment approaches for COVID-19. The first approach is the use of convalescent plasma. Some of the pros include that it treats patients who caught the virus early on, or for those who have not actually had it yet. The cons is that it doesn't treat everyone, and the amount of global supply means there may not be enough for everyone. The second approach uses stem cell therapy. Some of the pros include that it uses MSC stromal cells, which means that they are low invasive but have high proliferation. Some of the cons are that it is dependent on stem cell banks, which means there may be a limited supply. The third approach is the use of T-cell therapy. Some of the pros is that it aims to reprogram T cells in order to eliminate virus-infected cells. And some of the cons are that it is an expensive global solution. There is still no official cure for COVID-19, but here are some of the questions I am still left with. Which approach is the most effective treatment for COVID-19? What other forms of treatment are still being looked at as a vaccine for COVID-19? Are there side effects for these COVID-19 treatments? And which approach is the most cost-efficient and easiest to reproduce? Treatments and vaccines for COVID-19 are still and should be researched before being released to the public. But the future for vaccination is rapidly advancing thanks to COVID-19.